A patient who comes to the ED repeatedly requesting narcotics is really circumventing a system of checks and balances meant to protect them. So what begins as a stopgap therapy to help a patient becomes a revolving door, leading to prescription narcotic abuse and really misuse of important resources. Once this cycle is created, it becomes almost impossible to close the door. Doctors either administer narcotics and prescriptions on demand or inefficiently investigate chronic pain patients while missing the bigger picture. The ED doctor isn't set up to manage chronic diseases, whether it's diabetes or hypertension or chronic pain. And administering narcotics on a repeat basis for chronic pain patients really undermines their long-term health and deprives them of real care. By prescribing narcotics on demand, we become part of a larger problem. Drug administration without oversight and crisis intervention without comprehensive care. And because of these problems, the issue has really gained publicity. The federal government wants to regulate prescribing practices of narcotics. Regulatory agencies want us to safely and adequately address pain for health and safety reasons. Administration wants policies they can turn to with consistency among providers and less wasted money. Staff wants us to set limits on patients' demands. And meanwhile, chronic pain patients are dying by the thousands from accidental drug overdoses and adverse prescription drug interactions. A comprehensive solution is imminent. And where it comes from, really, it's up to us. Either it's going to come from the top down, or emergency departments will reform their practices. And the system will be much better if it comes from departments themselves organically. Rational pain care is a ground-up solution, and it was created by emergency physicians. It's user-friendly for staff. It satisfies regulatory agencies' risk management concerns, and best of all, it really allows the doctors and nurses to compassionately provide appropriate medical care. We know emergency departments are busy and overwhelmed. And Rational Pain Care, the program is designed for ease of implementation and sustainability. We train physicians, administrators, and staff on effective use of the programs, and we meet with the risk management teams, the managers, and we discuss all the legal and ethical aspects. And all members of the ED team have to be on the same page in order for this to work cohesively. Nurses love this program because repeat chronic pain patients can be pretty difficult to work with. And patients actually appreciate not being vilified when they come to the ED. They can actually get the care that is appropriate for their condition. Doctors have the power to say no, and risk management staff have practices worth defending. Our goal is to bring this program to every emergency department and help physicians regain control, help nurses refocus on treating pain compassionately, and help administrators in these difficult economic times utilize resources more efficiently and more effectively. It's the right thing for physicians, for the community, and for patients. And I think with Rational Pain Care, it is definitely the most medically appropriate and compassionate response that we can deliver.